Welcome back to Ask Me Doctor Weekly Q&A. I am Hazel from motherhood.com.my. We are now at week 3. Our topic for today is complications in pregnancy. What is the meaning of complications in pregnancy? It refers to the health problem occurs during pregnancy. They can relate to the women's health, baby's health, or both. Some women have some health problems before they are pregnant, while some may have it during pregnancy. Whether a complication is common or rare, there are ways to manage it. Today we have Dr. Timothy Lee Xinren, obstetrician and gynecologist from Tongshin Hospital and Sunway Medical Center with Lost City, to be here with us to answer your questions on Facebook and Instagram.
Dr. Timothy, can we start with what are the common complications during pregnancy?
Right, complications can happen during the early phase of pregnancy as well as the later phase of pregnancy. Complications that are common during the early phase are like morning sickness, or the more severe form which we call hyperemesis gravidarum. Miscarriages can happen during early pregnancy as well as ectopic pregnancy or a pregnancy outside the womb. In later parts of pregnancy, women may sometimes develop high blood pressure during pregnancy, or what we call a gestational hypertension. Can develop gestational diabetes. A more severe form of high blood pressure we call preeclampsia, right? Some of them may have preterm labor and infections like urine infections or even infections after a rupture of membranes. For example, when the water bag breaks early, or the condition we call PPROM, sometimes infection can set in. And we call this chorioamnionitis.
Can you share with us who is or are at risk of these complications? Are there any common illness or diseases that will mean this woman is of a higher risk? What is the factor that would increase the woman's risk of getting complications in pregnancy?
Well, there are many risk factors that can contribute to complications in pregnancy. When we assess women who are getting pregnant, we need to get a thorough history and a physical examination in order to identify this risk. So, history that we would like to know is basically the age of the woman, right? Because we do know that women who are very young, meaning teenagers, who get pregnant, or women who are more than 40, they do tend to get complications. For example, gestational hypertension or high blood pressure. We also need to assess their underlying medical problems, meaning they have any medical problems to begin with before they get pregnant. Medical problems can be high blood pressure, it could be diabetes, it could even be any autoimmune disease, or kidney disease, heart disease, which can impact the pregnancy. Besides that, we also would like to know if this woman has been pregnant before, when they having any complications during their last pregnancy. For example, they have any miscarriages before, they have any ectopic pregnancy before, did they develop any medical conditions during the pregnancy. Other than that, if they have been pregnant before, we are also interested to know their previous mode of delivery, whether did they deliver by a vaginal delivery or did they deliver by a cesarean section. Other than that, we would also like to know family history. Do they have any family history of medical conditions, family history of abnormal babies, family history of twin pregnancy. All this will carry a risk to their current pregnancy.
Okay, and if you have previous history or family history, that could be the factors that lead to your complication pregnancy. For the next question, is abdominal pain or cramp during pregnancy, is it normal, or would it be a sign for any complications?
It's quite common for pregnant women to get cramps, lower abdominal pain during pregnancy. This is usually because of the stretching of the ligaments that support the pelvis. During pregnancy, the pregnancy hormones actually causes relaxations of these ligaments. Compounded by the growing uterus, it will then stretch the pelvic area and sometimes cause cramps and a little bit of pain. However, we need to exclude other dangerous conditions such as ectopic pregnancy, miscarriage, even other non-gynae related conditions like urine infection, appendicitis, which can also happen during pregnancy.
A woman is at her 9th week of pregnancy. One day she has stomachache and bone pain, stomach felt very hard and full, difficulty in breathing, and affected her sleep as well. Is this a type of complication in pregnancy? would there be anything potentially happen to the baby?
Yes, this is likely a complication of pregnancy. Yeah. So based on the brief history here, patient has stomach ache and bone pain that I assume should be a back pain. The possible causes for this could be, number one, it could be a miscarriage. It could even be an ectopic pregnancy if we do not know where the location or the woman have not confirmed whether this pregnancy is inside the womb. This could be a sign of an ectopic pregnancy, meaning the pregnancy is outside the womb. The other things that can happen in this kind of situation is possibly an infection. It could be a urine infection. Okay. It could even be other non-gynae related infection like an appendicitis. Yeah. Or even a gastritis. Yeah. Because in early pregnancy, women tend to be having nausea, a lot of vomiting, poor appetite. Sometimes they may get gastritis as well. Based on these symptoms, we will need to get further history and the physical examination to determine what is the actual problem that these women have. Will there be anything happening to the baby? Of course, some of this condition can actually be dangerous to the baby. For example, if it's an ongoing miscarriage, then yes, it's going to harm the baby.
Because 9 weeks is still the first trimester, so there's still a lot of risk there.
Yeah.
Our next question is on, does birth control and or abortion, some women use birth control but still conceive baby. Will the birth control potentially lead to any complications in pregnancy?
Some women may be taking birth control accidentally without knowing that they are pregnant. The birth control pill should not affect the pregnancy or cause any complications to the baby. Yeah. There is very little risk of birth control causing birth defects or problems during pregnancy.
Now, question number 6. If a woman had 2 abortions earlier, will that bring to any potential complication if she is pregnant now?
First of all, we need to know these abortions. Are they due to miscarriage or are they a termination of pregnancy due to some reasons? Like, for example, the baby is unhealthy. Yeah. So we need to know if it's a recurrent miscarriage, whether will this repeat again in this current pregnancy. Yeah. So if it's a condition that has led to the miscarriage, for example, if the mother has had previous medical problems, then we would need to correct the medical problems before she embarks on the next pregnancy.
Get the treatment first.
Yes. Certain conditions that can lead to recurrent miscarriages are like diabetes, thyroid disorders, even blood disorders. Yeah. So we will need to diagnose them and correct them before they go for their next pregnancy. For women who has undergone termination of pregnancy, we need to know what was done previously. Yeah, was it done through a medical termination or was it through a surgical termination, which is in the form of DNC? Yeah, we do know that multiple DNCs actually increases the risk of a woman developing placenta previa. Placenta previa is a condition where the placenta implants at the lower part of the uterus or covering the cervix. This is a very dangerous condition because it can lead to life-threatening bleeding.
Question number 7. After suffering from endometriosis, a woman is finally pregnant. Will this health condition affect her pregnancy?
Okay, first thing first, endometriosis is a condition where the endometrial lining or the lining of your womb grows outside the womb. Yeah. This endometrial lining can actually grow around the pelvic area, it can grow around the ovaries, it can grow around the abdominal lining. Women suffering from endometriosis usually gets chronic pain. It could either be a chronic pelvic pain or it could be a severe form of period pain. Women with endometriosis who are pregnant, they generally do quite well. They should progress like any other healthy pregnant woman. In general, endometriosis do not usually cause much complications in pregnancy.
Endometriosis, fibroid, herpes, what's the percentage of women getting it? Is it 1 like 10, 1 over 20, 1 over 100?
Fibroid is about 20% of women. They actually have fibroids. Endometriosis, not very common, but sometimes it's underdiagnosed because women sometimes they have severe kind of period cramps, but they take it as a normal thing.
How or when will you discover that someone is suffering from endometriosis? Is it through ultrasound or at her first trimester you can tell?
Usually you diagnose endometriosis when the woman is not pregnant. They usually present with pain, chronic pelvic pain or severe period pain. Ultrasound scan, you can only detect endometriosis if there is a cyst on the ovary. We call it an endometriotic cyst. But if you do not have endometriotic cyst, then you will not be able to diagnose endometriosis through ultrasound. The only way to diagnose endometriosis is through procedure we call laparoscopy, which is actually a surgical procedure. So we put in a camera into the woman's tummy, so we actually have a look at the endometriosis.
If a woman has fibroids for several years and they have never caused her any problem, will it be a complication when she is pregnant now?
Fibroids are quite common among women. About 20% of women actually have fibroids. If it has not caused her problems before, it is likely that the fibroids are small and it does not distort her womb. So in this kind of cases, usually the fibroid should not cause any problems to the pregnancy. However, we do know that if you have a fibroid in pregnancy, you can potentially get some certain complications. Examples are miscarriage. If the fibroid is distorting your womb, you may get pain during your pregnancy due to degeneration of the fibroid. The fibroid can actually interfere with the growth of the baby, and it can even lead to malpresentation where the baby's position is not at its normal position.
The next question. A woman has herpes. Can her baby catch it from her?
Herpes is a STD. It is a condition where the woman develops small blisters over the outer part of the vagina. It depends whether it is a primary herpes, meaning that if this woman develops herpes for the first time, or it's a secondary herpes where it is a reactivation of a previous infection. Okay, so if it's a primary infection, that means the mother doesn't have any antibody, therefore she cannot protect the baby. So if it's a secondary herpes, means that the mother has had herpes before, but this herpes virus has remained dormant in her and now has been reactivated. Therefore, she has already had an antibody from the previous infection. So the antibodies will actually protect the baby. Herpes is dangerous if it develops during the time of labor or where the woman is just about to deliver. Because we do know that herpes develops at the outer part of the vagina, we call the vulva area. So this is where the transmission can happen during birth. If the woman has primary herpes, we will generally advise for a cesarean section to avoid transmission to the baby, where the baby can develop neonatal herpes.
But of course, consult your obstetrician and gynecologist first and have a proper examination, and doctor will advise which is the better way.
Yes.
Last question for today. How can a pregnant woman prevent complications?
Of course, in order to prevent complications, we need to identify what are the women's risk factors, right? We have to individualize every woman because every woman would have different risks. One of the ways is that these women can actually go for a pre-conception consultation with a gynecologist. Through this consultation, the gynecologist can actually take a thorough history. Basically they would like to find out regarding the woman's age, their previous medical history, previous surgical history, previous mode of delivery, previous complications in previous pregnancy, family history, and through the physical examination, we can actually identify other problems that may not be obvious. For example, the woman may have had a heart murmur, which will only be found out through physical examination. So from there, then we can actually identify the individual risk factors, get it corrected before the woman embarks on the pregnancy.
Alright, thank you, doctor. I hope by now you have more understanding in terms of the different complications in pregnancy. Above all, also always make sure you follow the very important healthy pregnancy habits. Stay away from drugs, alcohol, tobacco, and have plenty of rest, eat right, and you'll be well on your way keeping your pregnancy and your baby healthy. Thank you GetDoc and Dr. Timothy for answering our questions today. Sign up GetDoc Plus today and you can make your appointment before your next consultation with Dr. Timothy. Stay tuned for our next weekly Q&A. Remember to submit your question before Thursday and stand a chance to win free 2 years of free subscriptions from GetDoc Plus and 10 ringgit motherhood.com.my voucher. See you all next week!